Hello, everyone. My name is Chad Pierre. I am a grad student at the University of Florida. I am earning my master's in health education and behavior, and I will be talking to you today about my philosophy of health education. Um, I will first be talking about um, my personal beliefs, going into like how I was brought up, my values, how that affects um, my philosophy, how I came to like be in the field. I'll talk about like my past experiences, how I eventually come to like into the field, what I'm expecting, and who influenced me coming into the field. And I'll also be talking about the role of a health educator, as defined in the book, or what I think and believe the role of a health educator is, and how I plan to contribute, and my where I plan to work, and how I plan to like inspire others um, while working with them. In the book, Principles of Foundations of Health Promotion and Education, health is defined as a dynamic state or condition that is multidimensional, a resource for living, and results from a person's interaction with and adaptation to the environment. I agree with that definition. I believe that health refers to like your mental state of mind, how you're interacting with others, your physical health, your emotional like and your intellectual health. I believe that our goal as health educator is to improve the health status of people, um, by making sure that we address all the dimensions, not only just looking at one and just having our vision only focus on that one aspect. Um, I think that the way that we can improve people's health is to really looking at their quality of life. So seeing like the decisions that they're making, health decisions like food they're choosing to eat, maybe how their habits, washing their hands. There are many like factors out there that can be addressed, or stuff that you can like teach people or give them the knowledge so that they can see for themselves how their actions or maybe their behaviors is affecting their health, maybe to like their mental health, their physical health, or their social relationship, how that's affecting them. Um, what I love about the health education field, you can really see how you're impacting people's lives or changing their lives. Um, to my past experiences, that was one of the greatest factor for me to like want to pursue more in the field or get to like get more knowledge and get my master's, and like I'm thinking about getting my PhD, seeing like really how the impact that you can have on people's life, or like working with them to see them make the changes in their behaviors, and seeing how that really changes like their perspective on something that they were doing wrong. So really to understand my philosophy, I have to talk about my values, and it all starts with God and how I was brought up. My family is very religious, and I was brought up in church. Um, so throughout my life, I always try to have the correct course of action, make the right decision, uh, participate in like the correct activities, being good to others. Um, the second priority is my family. Um, my family's had always had an impact on my life through my professionally, personally, in every aspect. Everything that I've learned, or most of my values, come from my family because we're so close. Both of my parents work in the health field, and they're heavily involved with the community. I think that had a really big impact on how I view the world, on what I expect of myself in terms of working with others, or the type of work that I want to do, and how I want to spend my life, like working and my purpose. So I truly believe that the health education field is linked to like my purpose in life. Like once I came into the field, I could feel that um, that part of me being like fulfilled, like having found like where I really want to dedicate like my life or my work to. So I think that's really great. Um, so my goal is to like live a meaningful life, and if I have the means to being able to like help others and like in any way that I can, and choosing this field is exactly one of the reason why I'm one of the reasons why I'm in this field is because of that. I want to help communities and need like change their habits that are affecting them negatively, being like close to the community, make having a relationship with them, and like showing them type type of the way to go or how to improve. Um, that's why I want to be in the field. After seeing that, I know it's perfect for me. So in 2016, um, in the summer of 2016, I was able to travel to Haiti. Um, this was right after the cholera outbreak, and my dad was in charge of the health department and one of the regions, the Northwest regions there. And that was kind of the first introduction that I was able to have with public health, um, to the organization that he was working with at the time. I was able to work with him and volunteer, and I was able to see how everyone was coming together. Um, they were implementing like washing hands campaigns, and making sure that your surroundings are clean, and we had to travel across the country, and we stayed at like different communities. We talked to different people, like learning about how their daily routines and how they had to go by in their everyday life, and making sure that what we were telling them and what we were showing them were was also like compatible with how they lived. And it was kind of like my first introduction to public health. And after that, I was really passionate and fascinated by all the work that my dad was doing. And it was kind of like the first time I got to see that you could save lives to like sharing knowledge or showing someone skills. It wasn't just like you had to be a doctor or surgeon to save life. You could do it primarily before the disease, or you could work on prevention. So it kind of opened the spectrum for me. Um, a second experience that I had that really um, helped me or cemented why I wanted to keep going on health education was shortly after my trip. I was able to, when I came back, unfortunately, one of my best friends passed away, and it was a suicide. So I didn't really know much about it, or I wasn't that exposed, or really thought that something like that would like be so close to me or would affect me like that much. So um, after I was able to learn like all these facts about like how mental health, how it's a taboo and black and the black community, especially where I'm from, Haiti. Haitians, they believe in like supernatural forces. So when someone really talked about being mentally healed, they kind of think that, oh, you've been taken over by a natural force. Um, so that really pushed me even more towards like promoting like health, like educating people about what's like about mental health, about issues that are out there in the community, trying to change people's perspective about stuff like that. Because I could see how that experience also it really affected my parents in a certain way on how they approach me or talk to me about how I was feeling about my emotions. So I know it was like something that could be addressed. And being in college now and seeing like society, how it's becoming more and more of an issue, I'm glad that I chose the field that I'm in right now because I see that I can uh, firsthand have like an impact in addressing it, you know, at least, for my friend. Um, so for before graduating, also, we also had to do an internship in order to graduate. Through that internship, I did mine at Hell Street, and it was a great experience because I got hands on experience on multiple aspect of public health. My focus was HIV prevention. I was able to get trained and certified and giving people exam, and I was trained to like how to talk to people, and you get to really learn um, where you want to work or and like what type of work that you want to do and a facility, if you want to work on like policy changing, if you want to work with the numbers, the biostats. It was really cool because I got to work in different areas and really experience what I wanted to do more specifically in the public health field. Also gets you ready professionally because we had meetings where we had to document like our work. We got to see like how the population was using the services that we were providing, and how really we were like helping people. Um, Also, like hearing their feedback and seeing them too after seeing them come in at the Hell Street facility. I would see some people out put on the bus at bus stop, and like just they would tell me like how it went, like their research went. I went there meeting with the doctor where we referred them to it. So it was kind of great to see like to get that experience right there through my internship. Um, I believe that health educators, the role of health educators in our society today is to, you know, help people see the issues in their community, gives them the knowledge to see like the health problem that are present around them, and try to help them change those behaviors in order to improve their quality of life and prolong their life. So the role is to teach people and really help them maintain not only their physical health, their mental health, social health, and every other dimension of health out there. Um, Personally, I'm very interested in like disease prevention and reducing risky behaviors for communities. So, like for my health education career, I want to mostly work with low income communities or communities that are underserved, really to help those people improve their quality of life. Um, and maybe at some point take it to another level where I could work globally, where I could go to countries that are in need of implementing program in order to help get clean water, prevent disease spreading. Because I know through the work that my dad did in Haiti, it I know I could be helpful after earning my master's degree in health education here. um After an assignment, you were able to see which health education philosophies that you could mostly align yourself with. And I still stand by the social change philosophy. Well, where you get to make changes in the community, to see those healthy behaviors and see how it influenced the community to change and to really improve and become better. Also, the cognitive based philosophy, where you give the community the knowledge. Maybe they didn't know about the rates of HIV, how condoms can help more, and you give them some type of knowledge and see how their behaviors change after you give them that knowledge. Um, yes, so so health education is on the rise. The field is really expanding, and people are starting to notice more how important the work that we do is. And I'm glad that I was able to really learn about it, and I was able to join the mission. And I want to continue to become as skilled as possible, so I would be able to impact people's life the way I want to, and so I can have a meaningful impact to the people that I encounter throughout my career or while I work with others also. Thank you.